Hello everyone and welcome to Fletcher Farms Amarillo. I'm Julie Fletcher. We just got a new barn cat and she just had a litter of kittens, so I thought I would include them in this video since it's too windy to be outside today with the rest of the horses. So last Tuesday, if you follow on our Facebook page, last Tuesday we had a situation with Aurora and I wanted to give everyone a complete and full update on everything that happened with her last Tuesday. This is exactly what happened. Last Tuesday, Aurora had an acupuncture appointment. Aurora has cellulitis in her back left leg, and because of this condition, we were using acupuncture to help treat and drain her lymphatic system to help with this condition that she has. So that morning, I fed everyone a little bit later and got Aurora brushed so she would be calm for her acupuncture appointment. It's hard to see around Liam, but she's back over there getting brushed in this video. Dr. Hardy arrived to do Aurora's acupuncture. You can see her receiving her treatment there in the back, and Dr. Hardy's in the red sweater. As always, Aurora did really well with her treatment, and she even got some alfalfa to eat during the procedure. After her treatment, she went out and found her BFF, Amelia, and they were in the pasture for the rest of the afternoon. At around 3:30, I started sorting all the horses to get them fed for the evening for their dinner, and this was a video of Aurora coming inside and acting completely normal. While I was still sorting the horses and getting their food ready, I started to notice that Aurora was acting weird. I went back through our videos, and this was what I had seen. Aurora was attempting to lay down. A few minutes later, Aurora came to the gate and was flaring her lips. At the time, I did not see her flaring her lips because I was still outside, but sometimes this is a sign of pain in horses. After seeing her try to lay down outside a couple times, I opened her gate so she could come inside the barn. And as soon as I opened her gate and she was in her pine shavings, she immediately laid down and started rolling. In the past, we've had horses that do this right before dinner. They lay down and roll and just might have an upset stomach. So the true test was to see if Aurora was going to eat. And at this point, I brought her bucket out and she didn't even touch it. So at this point, I knew that she was colicking and that I needed to get her to the vet quickly. I called down to MVP and let them know what was happening with Aurora. They told me to administer Banamine because there were 3 other cases of colic coming in the same day and all at the same time. Corey was still at work, so I called him and he was heading home. I got the trailer hooked up, got some Banamine in Aurora, and I headed down to MVP to get her treatment. As I was taking her out of her stall, she did pass a pile of manure. So I got Aurora loaded up into the trailer, and as soon as I got her tied off and was about to close the back door, she started bending her front legs like she was going to lay down in the trailer. I was hoping with the movement of the trailer that she would stop trying to lay down so she wouldn't get herself stuck in the trailer. So when I got down to MVP, Dr. Wagner was still working on the other 2 colic cases. So they told me to take her out of the trailer and get her walking and moving since she was trying to lay down in the trailer. So as soon as I got her out of the trailer, she took a few steps and then laid down in the parking lot, and she was also completely covered in sweat. So I went back inside and told them what was going on. Dr. Wagner came out and pulled blood right away. Her heart rate was through the roof, and like I said, she was completely covered head to toe in sweat, which means that the horse is in a lot of pain if they're covered in sweat. So she ran the blood work. Her lactate level, which lactate levels are usually around 2 or so in a healthy horse, and hers were at 4. So they were slightly elevated, not to a point where it was overly concerning, but it was definitely elevated. So we got her, she finally did get up, and we got her into a stall, and Dr. Wagner administered fluids right away. Dr. Wagner inserted a tube into her nose that went all the way down into her stomach so they could put fluids directly into her stomach. When horses are colicking, this is a vital part of the process to help things move along in their system if there is a blockage. With Aurora's heart rate being as high as it was, Dr. Wagner was very worried that she was on the verge of something rupturing in her intestinal tract. So after Dr. Wagner got the fluids directly into her stomach, she started to try to lay down again, and she did get down again and started rolling. At this point, I knew that it was bad because Dr. Wagner wasn't going to be able to work on her if she continued to roll like this. At this point, she had already had 2 rounds of sedation and pain medications, and they didn't seem to be helping. Dr. Wagner was able to get a IV line in her, so she was getting fluids, so that was helping to try to move things along in her system, but it was a waiting game at this point. She did need to try to tap her cecum, and the cecum is part of their intestines that can hold gas. But the way that Aurora was laying in that stall, she wasn't going to be able to tap her cecum. The cecum is a part of the horse's intestines and is located on the right-hand side of the horse. When Aurora went down and stopped rolling, she did end up laying on her right side, so Dr. Wagner at this time wasn't able to tap her cecum. In this picture, she was resting comfortably and getting IV fluids. So our best bet right now was to try to get her up so we could get more fluids into her, because they had only just given her a little bit just to get her through, until we could get her up and into a stall if the medications like the Banamine and everything else that they were giving her for pain would actually start to help, and she would actually be able to pass this possible blockage. So we were able to get her up and got her into another stall, and Dr. Wagner was able to tap her cecum, and this was a video from that. Dr. Wagner inserted a large needle into her cecum to relieve the pressure and the gas buildup that was in there.
This is an antibiotic that will stop some of the gas production from bacteria.
Okay. So at this point now, it was just a waiting game to see if these medications were going to actually help her, and if tapping her cecum was going to help relieve some of the pressure. What Dr. Wagner feared at this point was that a horse's intestines kind of float in there, and one part's attached to their body and one part isn't attached to their body. So when they start rolling, they get twisted up, and at this point, with the way she wasn't responding to the medications and the fact that her lactate levels were continuing to go up, the third time that she had tested them, her levels were up to 6. So it was not looking good. She wasn't responding to the medication, and her lactate levels were getting higher. Usually with lactate levels that continue to rise and elevate means that there's something in the horse's digestive system or an organ that's just not functioning properly, and Dr. Wagner was really concerned that her intestines were twisted. So it was a waiting game now to try to see if she would continue to respond to the medications, or if there was anything else that we could do. Surgery was definitely not an option because the table at MVP was not going to be big enough to support her. And after everything that we went through with Finn, we did not want to put another horse through that. And Aurora is 20 years old. So we were going to give her some time and see if she would respond to these medications. So I stayed with her, and at about midnight, Dr. Wagner said, let's give her some time and let her rest on her own and see how she does. And she was going to call me in the morning. I got a call at about 2 o'clock in the morning. Dr. Wagner had gone back to the clinic and tested her lactate levels, and they were at 9. So at this point, she was just not responding to treatment, and she was just in a lot of pain because she was still continuing to roll. So the best thing that we could do for Aurora was to put her down. And that was the most difficult decision that we had to make, but it was best for Aurora because there was no way that she was going to be able to get through this, or she was going to pull through on her own. Dr. Wagner said if we waited any longer, that we would probably be putting her at risk for her intestines to rupture and for her to pass away on her own. I didn't think that that was fair, and definitely not the most humane thing that we could do, knowing these conditions and knowing that that was a possibility if we let this go on any longer. That was something that I didn't want to put Aurora through. So I got up and I got dressed and went down to the clinic and stayed with Aurora until the end. This was extremely devastating and definitely not something that we thought we'd have to do, especially with her. We thought we had her on the road to recovery after she had her surgery on her eyes, and we thought, with her chemotherapy and her making friends with Amelia, that she was going to have a long and happy retirement. And it just stinks when we aren't able to give these horses the long, happy retirement that we want to give them. Knowing that Aurora had the last couple months here to be able to make friends and be part of a herd makes all of this worthwhile, and that she was able to live like a horse. These are some videos of Aurora from the time that she was here on our farm. Skinny girl. There you go. You need to get some weight on you, sweetheart. Look what alfalfa is. Good girl. Yes, you are. Okay. I'll see you tomorrow, okay? You be a good girl. I love you. Did you get her, Charlie? Would you like a muffin? Yeah, exactly. Then everything that happened on Tuesday, Wednesday night, I went to go feed everybody and Elias was laying down in his run. After everything that happened the previous night, I was terrified that I was going to have to go through this again with Elias. I got him up and got him down to the vet's office. Elias is on the left and Arabella and Lena are on the right. Elias didn't want to go into a run for dinner, and that's very unlike him. He also did walk a little further and then he laid down. When Elias laid down in his run after I got them sorted, I knew something was wrong. So I got a halter on him and I got him up and we got him down to the vet's office as soon as we could possibly get him there. When we arrived at the vet's office, I got him out of the trailer and got him walking. However, he was very upset to be away from the herd. Dr. Wagner did a colic exam on him. She gave him fluids directly into his stomach, and she also did an ultrasound, and that's what you're seeing right here. She did blood work. She also did a rectal exam to make sure that he didn't have an ileum impaction, and everything actually checked out well, so he spent the night after receiving some pain medication and came home the next day. Thankfully, Elias came home on Thursday and everything was okay with him. He did come down with a little bit of a temperature a few days afterwards, so we did have to put him on some antibiotics, but he is doing better now, and we're very grateful that he wasn't colicking and that it was just an upset stomach or just him coming down with an illness. So to cover the costs of these vet bills, we were definitely not expecting to have these vet bills with these two horses this close together. We are going to be doing a fundraiser. So the information for the fundraiser will be at thebighoof.foundation.org, and I will put all the information of what is in the fundraiser. If you'd like to support us, please head on over to thebighoof.foundation.org and you'll see the fundraiser on the homepage. We do truly appreciate all of your support, generosity, and kindness, and we really can't thank you enough for everything that you guys have done for us. Stay tuned, and we will have more updates coming for you. Thank you, everyone, again for watching. We truly appreciate your support. Bye.